I get up at 6 o'clock every morning and walk 4 miles. I couldn't do that 6 months ago.
The second most common cause for visiting a primary care physician outside of the common cold is for back pain or spine pain.
The Norman Prince Spine Institute is our single door for spine care here at Lifespan.
We're able to bring different practitioners across the spectrum with different specialties together under one roof. We're able to deal with very complex diseases of the spine, in addition to the normal degenerative disease that we see most often.
We have the world's experts here. We have the state-of-the-art technology. We have all the specialists that the individual might need: neurosurgeons, rehabilitation physicians, interventional pain physicians, neuropsychologists, experts providing acupuncture care. In many situations, the patient would be receiving a combination of all of these modalities, and all of them are available under one roof, in one building, under Norman Prince Spine Institute.
We meet once a week to discuss our mutual patients across the medical, that's the non-surgical, and the surgical arms of the program. What we talk about is basically ensuring that we are devising the best plan for each individual.
The main goal of the Norman Prince Spine Institute is restoration of quality of life, returning to work and spending time with your family. The medical arm of the Norman Prince Spine Institute is the conservative side of spine care. It focuses on rehabilitation. Not all patients require surgical intervention.
The emphasis currently is toward the least invasive possible intervention.
Physical therapy, occupational therapy, pain psychology, chiropractic care, acupuncture, massage. When we do take a patient to surgery, it is because we have done our very best to establish the diagnosis, to make sure we know exactly where the problem lies. So an analogy: if you have a carpenter working on a construction project, you want your carpenter to have a number of different tools in his toolbox. It's a very sad day when your carpenter comes with just a hammer, because then every problem is going to be treated as though it were a nail. With the Norman Prince Spine Institute, we pride ourselves in having multiple tools in our toolbox.
I specialize in the most minimally invasive spine surgery possible, endoscopic spine surgery that I perform through a tube the size of a pencil, through an incision the size of a pea.
My subspecialty is the congenital disorders of the spine and the spinal cord, meaning all the conditions that a person is born with. Usually that stems from something that went wrong in the embryo space. These conditions sometimes don't show up until later in life.
I specialize in complex spine surgery. That means I specialize in general in spine surgery, but I also do very complex surgery, whether that be deformity or tumor or other disease states that require specialized sub-training in spine surgery. I deal with the hardest problems in spine in general.
My patients come from all over the country.
We've had patients come from more than 20 different countries across the world, as near as the Cayman Islands, as far away as Asia, China, Southeast Asia, Singapore. They're coming because they know they're getting the best possible care in the world.
The local patients are getting the same care that people are traveling from around the world for.
I was having trouble bending and I was having pain just bending to tie my shoes. To have this trouble at 56 is kind of young. I went for physical therapy and they found a tumor on my L4 spine. They operated and took part of the disc out. The tumor came back a year after that. Again, went for physical therapy, tried the pills, nothing worked. So they suggested this procedure. They go in and killed the nerves. After 2 days, I started feeling better. I'm able to walk 4 miles a day. I'm able to do gardening, cut the grass, do laundry, walk up and down stairs. You take it for granted every day. At 56, you want to do these things.
Everything we do at the Norman Prince Spine Institute is focused on the patient.
Even though you have a common condition, everyone is unique. Everyone has a different nuance of how the pathology presents itself.
We treat the patient as an individual and treat the individual, not just the disease.
Every patient we care for, we treat as if they were our own family. So if we're offering care or surgery to a patient, that's the same surgery we would offer our mother, father, or child.
Clinical expertise is obviously what we do. That's how we treat patients. The teaching is what we pass on to the next generation of experts. The research is how we keep ourselves on top of our game, essentially. It's very exciting to have an institute that draws from the strength of the Department of Neurosurgery at Brown University, one of the leading institutions when it comes to cognitive neuroscience, and Lifespan, the leading health entity in the state of Rhode Island.
Advances that I make in the lab are almost immediately applied and offered to patients as the most cutting-edge technology.
We are doing some very exciting, cutting-edge work that I believe is going to be the wave of the future in the field of spine surgery and spine care. So it's a very exciting time for us.